Well, hi, I'm Mike Farrar. I'm the Chief Executive of the North West SHA, and that's the Strategic Health Authority for the North West of England. This is our new website, and this is the first chance I've had to speak to you all via this broadcast. I'd like to tell you a little bit in this broadcast about the things that we're doing in the North West, and tell you what we hope will happen for the National Health Service across our region. The first thing is to tell you a bit about the numbers involved in this. We actually spend £9.5 billion of taxpayers' money, that's North West taxpayers' money, in the North West on our health services, and we serve about 7 million people. We make up roughly about 15% of the whole country. So what goes on in the North West is important not just for us in the North West, but also for the National Health Service overall. We at the North West Strategic Health Authority are charged with managing, if you like, the National Health Service in the North West, and we are responsible for making sure that the primary care trusts who spend your money on your behalf spend that well and get the best value for you and the highest quality services. And we're also responsible for the providers, NHS providers in the North West, who provide primary care, hospital-based care and some specialist care in some regional centres. And so our aim is to make sure that all the money that we spend adds up to really good value and high quality services for the people of the region. In fact, we're also the largest employer, I think, of people in the region. So we're very key in terms of the economy of the North West, and we make huge investments in our infrastructure, in capital projects like big buildings and hospitals, and also in IT and training and development of staff and people. So the National Health Service in the North West is a very important bit of the region's economy. Our vision at NHS North West is to try and do that as well as we possibly can, and we've set our goals at the highest possible level. We'd like to be world class in all that we do. That starts with having world class health services, and we've been looking around the world to try and find out where people are doing things better than we are now, so that we can meet those kind of standards, and in fact we'd like to improve on those standards. One of the things that I'll soon be able to tell you about is an initiative called Living Longer, Living Better North West. And what we're trying to do there is really empower people in the North West to take more responsibility for their own health, and to try and work with them using our health professionals like GPs and consultants, therapists, nurses, clinicians, other carers, to empower people to look after themselves better. That might mean things like trying to help people reduce alcohol consumption, where we've got some of the highest rates of serious drinking, and unfortunately amongst our younger people in the North West. And also we have some real problems associated with smoking and drinking, like cancers and coronary heart disease, where our rates are much higher than we'd like. And Living Longer, Living Better North West is going to be a big campaign to really target that and improve the standards of health of people in the region. So more about that soon. Another initiative which will involve people in their healthcare is really about decisions as to where to go when they do need treatment and care. As you're probably aware, the government is very keen to make sure that in the new NHS people can have choice as to where they go when they need treatment. And we're going to be setting up an initiative called Patient Opinion, which will help patients score the services that they receive, both for the quality of care but also things like the way they're treated, the customer care, if you like, that they get, the car parking, the hospital food, the way in which they get information about their care, so that when they've had the experience they can pass that on to other people who might be thinking about choosing those hospitals or those services. Patient's Opinion will be electronic, it'll be a web-based initiative, and it will help people identify the best places to go, the shortest waiting times and the highest quality services. So again, we'll be involving people in the North West in thinking hard about where they want to receive their care. They're just two examples of real innovation that we're going for in the North West. We believe that when we spend so much of taxpayers' money, we've got to constantly strive to get the best, and we've got to be looking for new ways of doing things that represent better value for money and actually deliver really good returns for people's investment. And so we'll be looking to develop something called Smart Practice, which is a way of signalling where people are innovating, and try and get that spread across to all our organisations, so that where we do get the best, we can make sure we can receive that all across the North West and not just in small pockets of populations in the region. Finally, I thought it might be helpful just to talk about some of the challenges that we face. The NHS is going through a major series of reforms. We're looking to create patient choice. We're looking to make sure patients aren't simply obliged to go to one local provider, particularly if that local provider is not offering the quality that they'd like. We want to include more people in the range of choices, just as you would if you were going to choose from a bank or another form of public service. And we're looking to give that choice to people in the North West, but it does present challenges. We're having to work with our National Health Service providers to make sure that our emergency services are protected, and we're having to work with our independent sector and not-for-profit sector partners to make sure that they can come in and provide new services on a level playing field. And again, I'll speak more about that in the future. Just to end by saying this is the first time that we've tried to do this. We'd really appreciate your feedback. These kind of websites are developing all across the public services, and we feel in the North West that the National Health Service should be accountable to you. So we'll be trying to find ways of seeking your views, not only in terms of what we're doing in the North West, but what you'd like us to talk about in these broadcasts. So thank you for listening, and I hope that you'll come back to this site and listen to us again about the National Health Service in the North West.